By participating in research, you help us doctors and scientists answer the big question. Your involvement helps us to come up with real-world solutions to make healthcare better for everyone. Good morning, everyone. So my name is Salim Hayek. I'm a cardiologist and scientist, and a warm welcome to all of you, especially those who are participants in research. So I want to take a moment to say a big thank you to your incredible contribution. Some of you might think that you're just filling out a form, or giving out a blood sample, or answering some questions, but you're doing much, much more than that. So by participating in research, you help us doctors and scientists answer the big questions. Questions like, how can we better treat heart disease? Or what's the best way to manage diabetes? Your involvement helps us to come up with real-world solutions to make healthcare better for everyone. So you're the unsung heroes who help us turn scientific ideas to actual help for people. And it's not just about numbers and data, it's about improving lives, maybe even saving lives. And for that, thank you. You deserve a heartfelt thank you from myself, from our patients, from the scientists here. So know that you're not just a name on a form or a number in a study. You're a vital part of making healthcare better, not just for yourself, but for your children, for your neighbors, and for people you've never met. So on behalf of all healthcare providers, thank you for being part of this essential journey. Today, we're here to celebrate our study participants and to engage in conversation and mutual learning about this journey from participant to research to advancing healthcare. It's from the enrollment and initial engagement to conducting research and improving the patient experience. So here with us today are Precision Health faculty and researchers, along with organizational partners, supporters, and stakeholders with whom I invite you to engage in discussion, debate, and share your experience as a research participant. Now, we've got a packed but exciting agenda which will include short overviews of exciting research developments and from select Precision Health members, panel discussions from folks whose lives have been directly impacted by research, and lots of opportunities for conversation. Now, Precision Health is an incredible research infrastructure that spans 19 schools, colleges, and institutes, and close to 350 members who have received over $50 million in research funding to date, and who have been empowered by you, the over 100,000 participants in our research studies from across the country. And this is only a glimpse. Now, it's my great privilege to introduce someone whose impact on our institution and the broader scientific community is nothing short of transformative. I'm talking about Dr. Lori McCauley, the Provost and Executive Vice President for Academic Affairs. In academia, titles like Provost and Executive Vice President can often feel somewhat abstract to those who are not embedded in this institutional framework. But let's be clear, Dr. McCauley's influence is tangible and profound, and especially when it comes to initiatives like Precision Health here at the University of Michigan. And Precision Health is not just a buzzword. It's a paradigm shift in how we approach healthcare. It's about individualized care, tailored therapies, and prevention. But initiatives like this don't thrive in vacuum. They don't just come up and succeed. They require steadfast institutional support, interdisciplinary collaboration, and visionary leadership. Dr. McCauley provides all of these. So in short, Dr. McCauley's support has been instrumental at elevating Precision Health from an ambitious concept to a transformative reality. She doesn't just support science, she champions the application of science for the betterment of all, a mission we all deeply resonate with. So without further ado, please join me in giving a warm welcome to Dr. Lori McCauley.
Thank you, Dr. Hayek. And wow, that was like quite a nice introduction. I think it's probably the nicest one I've ever had. Welcome, all of you. I was just so delighted to see the audience for this, and that we are talking to study participants, to community partners, to staff, to researchers, and when I was reflecting on the agenda, I thought, you know, I have been all of these myself. You can see that I am a healthcare provider and have run a scientific research lab for the 30 years that I've been at the University of Michigan. So this just really delights me. As Provost and Executive Vice President for Academic Affairs, you know, as Dr. Hayek mentioned, a lot of people don't really know what that title means. And the most frequent question that I get is, so what does the provost do? Like, everybody knows what the president does. As provost, the 19 schools and colleges report to me, and so I oversee all of the academic affairs operations on our campus. So I'm also the chief academic officer and the chief budget officer, so I oversee the general fund. And through that, I'll just say that we have definitely been dedicated supporters of precision health. So the work that you're participating in is supported by many different sources, and you'll see some of that in the presentations today. I'll also say that, you know, I take this work personally because I'm a data addict. Maybe some of you are as well. Some of you are wearing these watches that tell you, like, you know, every step you take, your heart rate, etc. I also have a sleep ring, which tells me all about my sleep, the number of hours, the REM, all, you know, all this. And this morning, it actually told me, you know, that I slept well, which is always nice when you wake up in the morning to get that, you know, feedback. But it also told me that it has a new function. It can measure my stress levels during the day. And I thought, you know, I don't know if I really want to know that. But I'll give it a try. But anyways, I think, you know, at the heart of precision medicine is data that we can use to make our world a better place, to make us healthier, to improve our well-being. And for that, I thank all of you for partnering in that work. I'll also just say that our campus has made commitments to health and well-being across our campus. We have joined what's called the Okanagan Charter to be a health promoting campus. And so we look at the lens of all we do through how we can improve health on our campus. One of the examples is in student health and wellness and our mental health initiatives. We've engaged in a telehealth operation where our students can access mental health support 24/7. And this has been really well received. We also have what's called the Wellbeing Collective that looks out for our faculty and staff on our campus. And I bring this to you because you're here, because you're engaged with the university, you are part of our health and well-being work that we do, because your health is also important to the health of our campus, to the health of our patients that we treat in our hospitals and clinics, and obviously your own health. And so I really just thank you for that participation. I'll also highlight that our health and well-being work also is just so closely interwoven with our work on diversity, equity, and inclusion. And we know that all voices on our campus matter and all voices in our world matter. And our campus has just been, I think, a leader in higher ed in this space. I have outreach frequently from peer institutions asking us how we deploy this work, you know, at the highest level. And I think what you'll see today is that it is just really integral to precision health and why we engage a broad study participation across our research studies. So thank you again for that participation. As a data addict, I'll also just highlight that we use data in our student success initiatives. So one of the biggest initiatives in the provost office is in student success. And we're now looking at all kinds of data. And actually, when I was on my way here, I thought, maybe we should retitle our student success initiative to Precision Student Success, because it really is very similar to much of the work that's going on in precision health. And that is, we take huge amounts of data sets to look at what are the things that we can put into place to assure our students are as successful as possible. So just one example I'll share with you. We look at graduation outcomes, and at the university we have really robust graduation outcomes, undoubtedly as good and better than most of our peers. And that is, for instance, over 93% of our students, have graduated within 6 years. This is one of the markers that we use, and that is considered really fabulous. Although if you pull through that data and look at specific populations, for instance, students who are first in their family to go to college, or students of low socioeconomic status, or students from underrepresented cohorts, their graduation rates are lower. And so we're looking, what are the things that we can put into place to assure that all of our students are successful? And I think that really mirrors some of the work that's going on in precision health as well. I also want to just give a shout out to not only our study participants, but also the staff that are involved in the work that we do. We have phenomenal researchers that are leading these studies, that come up with the creative ideas, but it is really the staff that are at the heart of this work. They're the individuals that care deeply about making sure that our study participants have all of the resources, all the information that they need as they're engaging in studies. So a huge shout out to our staff here today. Precision Health is a spotlight on our campus, a spotlight of promise and hope. And once again, I just really thank you for your participation. And I'll just end by saying, as a data addict, I kind of feel like it's like saying, can you have too much knowledge? Can you be too healthy? I don't think you can have too much data, or be too healthy, or have too much knowledge. So thank you for helping us generate that knowledge that'll make an impact in our world. And thank you for being here today.